other drugs. For example, we're gonna do the receptors for different drugs. Okay, for example, adrenaline act on receptor alpha 1, alpha 2, beta 1, beta 2, beta 3, and a non-adrenaline is going to act on the alpha 1, alpha 2, and beta 1. Isoprenaline beta 1, beta 2, beta 3, and butamine is beta 1, and dopamine is beta alpha 1, alpha 1, alpha 2, beta 1, delta d1. Okay, then we're gonna have the beta 2 selective. So in beta 2 selective, we're gonna have the salbutamol, terbutaline, and salmetrol, and formoterol, and bambetrol वगैरह. And the selective beta 2 agonist were these drugs. Now if we talk about the selective alpha 1, so in selective alpha 1 we are going to have the phenylephrine and methoxamine. And the selective alpha 2 agonists are the apraclonidine, brimonidine, clonidine, and the methyl dopa. Okay, now there's a drug called ritodrine. It is a beta 2 agonist, selective beta 2 agonist, and it's going to be selective action. It's gonna have the selective action for the uterus. Okay, so it can come in the MCQs as well, that if there is going to be option of ritodrine, to which of the following is going to be selective for the uterus. Okay, now we're gonna do the amphetamine. So amphetamine is the, wait a second, first of all we're gonna do the beta 2 selective, the salbutamol, terbutaline, formoterol वगैरह. In this we're gonna do their therapeutic uses. So it's gonna be used for three things: the bronchial asthma, premature labor, and it's gonna be used for the hyperkalemia. So this is done. And if we talk about the adverse effect of these beta 2 selective beta 2 agonists, these are the tremors, tachycardia, palpitations, and hypertension as well, and hyperglycemia and hypokalemia, because it causes the shift of the potassium into the cell. Okay, now we're gonna do, this is the alpha 1 selective, which I already told you, which contain the phenylephrine, methoxamine, and mephenteramine. So they are going to cause the vasoconstriction, increase the peripheral resistance, and increase the blood pressure. Okay, so we're gonna have the drug called the amphetamine. So if we talk about the amphetamine's action, so it's going to the action are like, yeah, it can come in the paper as well, but before doing the action, just do the their uses. So it's going to be used for the just remember the mnemonic: ANOB, attention deficit disorder, narcolepsy, obesity, and the barbiturate poisoning. It's going to be used for these. And if someone have the amphetamine poisoning, so what we're gonna do, we're gonna give the person acidic substances, for example vitamin C, and vitamin C will increase the excretion of the amphetamine. And we are gonna give the sedative for CNS actions, and apart from that we're gonna give sodium nitroprusside for the hypertension. Okay, so if we talk about the mechanism of action of the pharmacological action of the amphetamine, so it's going to have CNS action, and it's going to have the cardiac stimulant. And in CNS action, the therapeutic dose it is going to cause insomnia, alertness, euphoria, and increase motor and physical activity. But in chronic doses, it's going to cause depression and suppresses the appetite and impair performances. Okay, now we're gonna do the dopamine. So dopamine is the drug which is gonna act on alpha 1, alpha 2, beta 1, and D1. Okay, so the dopamine action on the basis of receptor is really important, on the basis of their concentration. So first of all, low dose, moderate dose, and high dose. Okay, in low dose, for example, if we give dopamine less than 2 mcg per kg per minute, so what's going to happen, it is going to act on the D1 receptor, and it is going to cause the dilation of the renal mesenteric and coronary blood vessel, renal mesenteric and coronary blood vessels, and because of that the GFR will be increased and urinary output will be increased. Okay, it is going to cause dilatation of the renal mesenteric and coronary blood vessels, and the GFR and urinary output will be increased if the concentration is less than 2 mcg per kg per minute. Okay, now if we give it in moderate dose, which is less than 5 mcg per kg per minute, so it is going to act on the beta 1, and after acting on the beta 1 receptor, it is going to increase the force of contraction and the heart rate, but it does not it does not causes the tachycardia. So the tachycardia is really less common. But in high doses, you're gonna act on the alpha receptors, so alpha 1, and it's gonna cause vasoconstriction. So because of this, the blood pressure will be increased. So the therapeutic effect is only from low to moderate dose, but in high doses, the therapeutic effect is totally gone. Okay. Now, if we talk about the effect of the dopamine, it can be used for septic and cardiogenic shock, as well as the renal impairment and the cardiac disturbance, cardiac failures. Okay, that's it. What were the uses of the dopamine? They were used for the cardiogenic shock, septic shock, and renal failures, and the heart failures, renal impairments. Okay, now we're gonna do the phenyldopa. Phenyldopa is D1 agonist. It's gonna act on the D1. It's going to cause the vasodilatation. Blood pressure will be reduced. Okay, and the side effects are the headache, flushing, reflex tachycardia, and all those stuff. And that's it. Thank you.